Hello, and welcome to our training on water safety. This is a required training from Child Care Regulations effective in 2024. The training that you're about to go over is verified and approved by the Texas Early Childhood Professional Database System, or TECPADS, training ID 34974. Before we get started, let's go over some training tips to help you be successful. First off, take notes so that you can go over this material with your school director before participating in swimming activities with the children. It is important that you clearly understand your building premises, the swimming pool that you will be using, or the swimming pool that you will be taking children to on a field trip. When you create your profile with timthetrainer.com, be sure to enter your personal TECPADS ID number. That way, when you complete this training, your certificate will automatically be uploaded into the database system. Also remember that when you're completing trainings, either this topic or any topic that you complete, the number of training hours that you complete in a day cannot exceed the number of hours that you actually work. Most importantly, the number of trainings that you complete in a 24-hour period cannot exceed 24 hours. And you also have to sleep during that time, so be careful with this. If you complete more training hours than you have in a workday, Child Care Regulations may not accept those training certificates. At the end of this training, you are going to complete an assessment with right or wrong answers. You may notice at the bottom of the screen, the bottom of the PowerPoint, I've given you some sample questions that you may see later on when you complete your assessment. So it might be good for you to take notes and pay attention to that as we go along. In this required training, we're going to go over two different items. We're going to go over the water safety requirements that are required by Child Care Regulations. We're also going to go over water safety techniques that have been outlined by the American Red Cross. This training is required for any caregiver and the director of the program who allow children to access a swimming pool either at their facility or away from the program on a field trip. Even if the director is not going on the field trip, the director of the program is required to have this training. First, let's go over some terms and definitions that you need to be familiar with as we go through this course. You're going to hear me talk a lot about a personal flotation device. A personal flotation device is a United States Coast Guard approved jacket. All right, many of us are familiar with life jackets, whether in a swimming pool or when going to the lake. Many parents have life jackets that they may provide, or you may choose to provide the personal flotation device yourself at your facility. Just remember, any life jacket that is brought into the facility, either by the parent or provided by the school, must be approved by the United States Coast Guard. It is going to be your responsibility to make sure that this personal flotation device is approved by the United States Coast Guard. When you open the inside of the life jacket, you will be able to see the approval. Just because the parent sends in the life jacket does not mean that it is an approved life jacket. So once again, it is going to be your responsibility to make sure that the appropriate personal flotation device is brought into the program. The next definition that you need to be familiar with is the definition of a swimming pool. And this definition has changed from what has been previously in the Child Care Minimum Standards. A swimming pool is defined as an artificial body of water with a water depth of more than 18 inches. That is what has changed. Previously in the Child Care Minimum Standards, a swimming pool was defined as a body of water greater than 24 inches. So it is now 18 inches. Now there is a difference between a swimming pool and a wading pool. And there is a difference between a swimming pool and a splash or sprinkler play. What we're looking for right here is a body of water that is greater than 18 inches. So this could be one of those kiddie pools that you get, at the department store, one of those inflatable pools. If it's more than 18 inches, it is considered a swimming pool. If it's less than 18 inches, it's considered a wading pool. The next requirement that you need to be familiar with pertains to record keeping, and it is the permission that the parent or guardian gives for children to participate in swimming activities. So you want to pay close attention to this if you are a director or administrator, because you're probably going to have to update your enrollment form or admissions form, whatever you call it in your school. The permission basically now states permission for participation in water activities if provided. So this is an if applicable. If you don't provide water activities, then this permission doesn't apply, and you don't need to have this on your enrollment form. But if you are participating in water activities, you want to make sure that the updated data is on your enrollment form. All right, so permission for participation in water activities if provided. If you allow a child to access a swimming pool, the parent must also indicate, and this is where the change is at, the parent must indicate whether a child is able to swim competently as defined by the American Red Cross. It does also require the personal flotation device if the child is unable to swim competently as defined by the American Red Cross, or the child is at risk of injury or death when swimming or otherwise accessing a body of water. And I'll go into a little bit more detail on that right there later on in this presentation. Now, I've been working in the early education and after school industry, for a really long time, since 1987. I've worked at many different programs that had swimming pools. I've taken many hundreds of children to water parks and swimming pools over the year. And I will tell you one thing that is very, very consistent. Even though the parent indicates that the child cannot swim competently, that child is going to tell you otherwise, all right? Children love to have confidence in themselves, especially when it comes to swimming, and they want to get that personal flotation device off of their body. And when you get to that swimming pool, they're going to say, "Hey, teacher, I can swim," Don't take the child's word for it. If that parent indicates on the permission slip that that child cannot swim competently, or if the child is at risk of injury or death, they have to keep the personal flotation device on. All right? So the child does not get to alter the permission right here. And again, they're going to tell you otherwise. The next change that we see in the child care minimum standards are the training requirements, which is why we're doing this video today. So when we talk about what additional training must an employee and director have if the child care center allows a child to access a swimming pool at or away from the center. If the child care center allows a child to access a swimming pool at or away from the center, annual water safety training must be required for each employee prior to accompanying a child to a swimming pool and for each center director. And like I said earlier, even if the center director is not going on the field trip or participating in the swimming activity, the director of the program must also have annual training on water safety. Now, this is also extremely important for everyone to understand. Your water safety training is exclusive of any requirement for orientation, pre-service training, and annual training. So this training that you're doing today does not count towards annual training requirements. It is a completely separate expectation. Okay, so be careful with this right here. It cannot be included in your annual training. It is completely separate. Think of it like transportation safety training. For those of you that transport children in buses and vans, your transportation training is also exclusive of annual training requirements, meaning it does not count towards annual training. This training that you're doing today on water safety is the same. All right, it is an additional requirement to annual training. We also want to be familiar with what is a lifeguard and when must you have a lifeguard, okay? A certified lifeguard must be on duty at all times when children are swimming in more than 18 inches of water. And once again, this is one of the changes that we've seen in the 2024 Child Care Minimum Standards. Prior to 2024, this definition read that a certified lifeguard must be on duty when the child is swimming in less than 24 inches of water. So again, it's the difference between the 24 inches and the 18 inches. That is what is changing right there. The certified lifeguard is the other key part. The lifeguard cannot be someone that you just quote unquote designate to be the lifeguard. They have to have an official certification to be a lifeguard. Now, you can go to the American Red Cross. There are courses that you can take, or you can have individuals take these courses to get their lifeguard certification. I actually have my lifeguard certification because I had a school for many, many years that had a swimming pool, and so I had my lifeguard certification as a backup. So, it's pretty easy to obtain, and I think it's really important. Even if you are going to a water park or a swimming pool that has certified lifeguards on duty, I think it is good risk management for you to also have employees on staff that have a lifeguard certification. Completely optional, completely up to you, but exceeding the expectation is always going to benefit your program. All right. The other thing I've learned in my experience is if you are going to a swimming pool away from your facility that has certified lifeguards on duty, you can't really rely on them either. All right. A lot of times these could be, younger employees that have a summer job, while they're out of school or while they're home from college. And while they may be very competent, dedicated, in it to win it people that are very focused on saving children's lives, sometimes they're not. All right. And I could tell you lots and lots of stories where, lifeguards have been distracted, not paying attention, sleeping on the stand, and it just was not a good situation. So that's why, once again, I recommend that you look into getting a lifeguard certification for either you or your people, just for added protection. All right. I also will tell you that from a planning standpoint, this is something that I always look at. If I do find a public swimming pool or a water park that the lifeguards are very attentive, they're very well trained, they're very focused on the swimmers, we will continue to use that facility. If I run into a situation where it's the opposite and the certified lifeguards are not doing their job, we probably won't go back there. All right. But it's really, really important right there to look at that. This is something else that is so incredibly important. And I see this all the time whenever I'm out visiting programs and doing different trainings for schools. Every caregiver and director included in child staff ratio that is taking children to a swimming pool, either at the facility or away from the facility, whoever is counted in child staff ratio must be able to swim, and they must be prepared to do so in an emergency. All right. So, you're going to need to have some conversations. If you're a director, you're going to need to have some conversations with your employees. Can you competently swim? And not only can you competently swim, but are you willing and able to do so in an emergency? If you are the employee that's going to be going on these swimming field trips or taking children to a swimming pool, if you are not able to swim, or if you're not willing to assist in an emergency, you need to immediately notify your center director. All right? You cannot be counted in child staff ratio if you cannot swim. All right? And once again, I have seen this so many times in my career where, the teachers that are assigned to this activity can't swim. And it causes a lot of problems, and it's not safe. All right? It's not safe. So that is a requirement that is in the child care minimum standards. Next, we're going to talk about what are some of the safety precautions that you must follow when the children in your care uses a swimming pool. And this is coming straight from the child care minimum standards right here. You must have a minimum of 2 life-saving devices available. Okay, so that could be the rings that we commonly see in swimming pools that you throw into the water. Anything like that is a U.S. Coast Guard certified life-saving device. All right. Now the rings and the blow-up toys and the giraffes and the flamingos that you get at the department store, y'all, those are toys. They're not personal flotation devices, but most importantly, they are not life-saving devices. All right? So once again, you want to look for that approval from the U.S. Coast Guard. If you have a swimming pool, or if you're going to a swimming pool that is greater than 2,000 square feet in surface, then 1 additional life-saving device must be available for each 2,000 square feet of water surface. All right. So if you have a swimming pool at your facility, you should know the size of your swimming pool, and you'll be able to determine how many life-saving devices am I required to have. If you're going to a water park or swimming pool, you're going to need to do some research before you go there. All right, you're going to need to pick up the phone and give them a call and ask them the square feet of the water surface at the park, and make sure that they have an adequate amount of life-saving devices to meet the child care minimum standards. So once again, just because you're going to a public pool or you're going to a commercial water park doesn't mean they necessarily meet the minimum standard requirements. You're going to need to do your due diligence right here. All right. Make sure that drain gates must be in place and must be in good repair, and that they can be removed without tools. Make sure that your pool chemicals and pumps are inaccessible to children. The machinery rooms must be locked when children are present. We don't want the children to get in there. Employees must be able to clearly see all parts of the swimming area. So once again, if you're allowing some of these flotation toys to be placed in the swimming pool, y'all, that causes a lot of visual distractions. All right, I would not recommend allowing the flotation toys to be brought into the swimming pool, because it just creates a risk. It creates supervision issues, and you could be out of compliance with the minimum standards if those flotation toys prevent the employees from seeing the swimming area clearly. Also, kind of going on to the next one right here, the bottom of the pool must be visible at all times. Okay? An adult must be present who is able to immediately turn off the pump and filtering system when a child is in the pool. Okay, especially if there's some type of suction issue. And we've got some really light children that don't weigh a whole lot that could very easily kind of be pulled down by that suction right there. You have to be able to turn those pumps off in the event of an emergency. Okay. The indoor and outdoor area must be free of furniture and equipment that children can use to climb over a fence or barrier, or to release a lock. The biggest thing right here is the releasing of the lock. all right, so that when your swimming pool is nice and secure, you know, you don't want children to be able to climb up and to release that lock and get in there whenever they're not supervised. Okay, so be careful with the furniture and equipment. Additional water safety precautions that you must take for a child who is unable to swim competently or is at risk of injury or death when swimming. So you may have a child that has a special care need. You may have a child that has a medical condition that places them at higher risk of injury or death. So, you know, that's what you want to look at right here. Once again, I'm going to go back to the record keeping part. Whenever you're getting permission from the parent for a child to participate in water activities under the special care needs, you know, you want to pay attention to make sure that this is listed. If the child has a special care need or a medical condition that is placing them at a higher risk, we want to make sure that that is indicated accordingly. All right. Now, the additional safety precautions that you must take here is that before the child who is unable to swim competently or is at risk of injury or death when swimming, before they enter that swimming pool, they must be provided with a type 1, 2, or 3 United States Coast Guard approved personal flotation devices. Now, there are 5 different types of personal flotation devices that are approved by the United States Coast Guard. Only 1, 2, and 3 are approved for children. So once again, when you're looking on the inside of that life jacket or that personal flotation device, you want to make sure that it is a type 1, 2, or 3. If it is a type 4 or 5, that is not approved for children. Make sure that the child is wearing the personal flotation device. Again, they're going to try to take these off. All right, I've seen it so many times right here. So you've got to make sure that they're keeping it on, and it is your responsibility to make sure that it properly fits the child and that it is fastened. All right, so once again, just because the parent sends in the personal flotation device doesn't mean that it fits properly. So it is your responsibility to make sure that it fits properly and that it's properly fastened. If you notice that the buckles are damaged or they're not in good repair, you're going to need to get that child a different personal flotation device. Right here, we don't see this very often, but some of you might be in a single skill facility or sometimes in after school programs we see this. But if you have a child that is participating in swimming instruction or a competition, so maybe you're doing private swimming lessons at your facility or you're taking children to private swimming lessons with a certified individual, someone who is certified to give swimming lessons, you are not required to provide the child with the personal flotation device and ensure that they're wearing it correctly if the child is actively participating in swimming instructions or a competition. And you make sure that the child is adequately supervised. All right? So that PFD or personal flotation device that can be taken off when you are doing swimming lessons or a swimming competition. Certified swimming lessons. Now, some of you may not take your children swimming, either at your facility or away from your facility, but a very popular water activity that we see these days is sprinkler play. Okay, either you have installed a commercial splash pad at your facility. I've installed 4 commercial splash pads in my experience at facilities. Or you're just going to the department store and getting the good old-fashioned sprinklers, and you're doing sprinkler play at your facility. Here are some safety requirements that you need to be aware of right here. Okay, sprinkler play must not be on hard, slippery surfaces such as concrete, rocks, things like that. A basketball court, those type of things. It needs to be placed on grass or sand, something that is soft. Children must never be left alone during sprinkler play. Sprinkler play must be out of the reach of children when not in use. All right, and the splash pad or sprinkler play area must be maintained according to the manufacturer's instructions. Where I most commonly see programs make mistakes right here is the third bullet point: sprinkler play equipment must be out of the reach of children when not in use. Many of you are using your playground or your yard to do your sprinkler play, and then the water hoses and the sprinklers are left out and they're not put away after the sprinkler play activity, and then the children go out onto the playground later on in the day or the next day and all of the equipment is still out there. That would result in a deficiency with child care regulations. A wading pool, like I said earlier in the training, a wading pool is defined as a body of water less than 18 inches. All right, so once again, your wading pools, if you are using these, must be stored out of the reach of children whenever they're not in use. So once again, they must be immediately put away when you're done with your activity. They must be drained at least daily and sanitized. All right, so once again, this is a very common deficiency we see. If you're using wading pools, for your children, they have to be drained and sanitized whenever they're done being used. And they must be stored in a way that they don't hold water. So if it starts raining outside or your water sprinklers come on to water your grass, if water starts to be held into that device, that could create a deficiency. So they need to be stored in a shed, they need to be stored in a closet, they need to be stored upside down so that they're not holding water right there. We do have a little bit of a different child-staff ratio whenever you have a wading pool present. So you can see these on the screen right here. 0 to 23 months, children that are 0 to 23 months, it's a 1-to-1 ratio for them. Now, once you get to a child that is 2 years of age, you've got a 1-to-2 ratio. 3-year-olds, 1-to-6 ratio. 4-year-olds, 1-to-16. A 5-year-old is 1-to-20. 6 to 8 and up is 1-to-22. Now remember, these ratios are only for wading pools, meaning you've got a body of water less than 18 inches. If you're just doing sprinkler play, okay, so you have a splash pad or you have water sprinklers out and there is no body of water. If there is no body of water, you're going to follow normal classroom ratios, okay? Now, once you do have a body of water, that's where the wading pool comes in, okay? A very common question that I get right here is, what about sensory tables or water tables? Do you have to follow the wading pool requirements in those situations? No. For a water table or a sensory table, the children are not being submerged in the water. They're not getting into it, all right? They're not supposed to be getting into it. If you do have a child that is getting into your water table, you've got some other issues going on there, all right? So keep that in mind right there. Some of this stuff with swimming pool requirements we've already gone over in a previous slide, but it's very important that we go over them again. And then there are also a couple of additional swimming pool requirements that you need to be aware of here. Once again, you must have those 2 life-saving devices, an additional life-saving device for each 2,000 square feet of water surface. Once again, your drains are in good repair and they're not able to be removed. Your pool chemicals and pumps are inaccessible to children. Your machinery rooms are locked. Make sure that all areas of the swimming pool are visible, including the bottom of the pool. And then make sure that the area is free from furniture and equipment that children can use to scale a fence or release a lock. Here's where the additional requirements come in. A 6-foot fence must be in place that goes around the swimming pool. The fence gate has a self-closing and self-latching hardware that is out of the reach of children. An adult must be present to turn off the pump and filtering system when any child is in the pool. Doors leading to the pool area have locks that are out of the reach of children and only can be opened by an adult. Exit doors leading to a swimming pool is not used as an emergency exit. So we kind of go back to our emergency preparedness plan here. And when you're creating your primary exits and your secondary exits for emergency evacuation, either your primary or second exit cannot lead into a swimming pool area. And then if you do have an above ground swimming pool, that must have a barrier once again. Remember, this is not only the responsibility of the Child Care Center director or the permit holder to make sure that your facility meets these requirements. It is anyone given the responsibility of the group of children that are participating in the water activity. You too are responsible for making sure that these requirements are met. If you see that your facility does not meet these requirements, you need to immediately report it to your center director. A lot of times teachers will say, "Oops, not my responsibility." Yes, it is. It is everybody's responsibility. Anytime it comes to the health and safety of the children, it is everybody's responsibility to keep those children safe. We do have ratio changes when it comes to swimming. You can see these on the screen right here. If you are taking children 0 to 23 months, you have a 1-to-1 ratio. When you're taking 2-year-old children swimming, you've got a 1-to-2 ratio. 3-year-olds are going to be a 1-to-6. 4-year-olds are going to be 1-to-8. 5-year-olds, 1-to-10. And your children 6 to 8 and up, you're going to have a 1-to-12 ratios. So you may notice that these swimming ratios are different than the wading pool ratios. So there is a difference between the two when you have a body of water greater than the 18 inches. All right? And again, it is everybody's responsibility to make sure that you're in child-staff ratio. It is not just the director and the permit holder's responsibility. If you are given an assignment to participate in water activities and you notice that the appropriate child-staff ratios are not being met, you must immediately report that to the center director. Let's move on to some water safety tips and techniques right here. We've talked earlier in the training about the personal flotation device. Here are some tips for choosing the right life jacket or personal flotation device from the American Red Cross. All right. Now, we've already talked in the past that all of your life jackets or personal flotation devices must be U.S. Coast Guard approved. Look for the U.S. Coast Guard statement approval and approval number on the label of the life jacket. And like I said, that's normally located right on the inside of the life jacket right there. Life jacket. Once again, there are 5 different types of life jackets designated by the U.S. Coast Guard, but only types 1, 2, and 3 have been approved for the use of children. The type 1 life jacket are designed to roll when the wearer faces up in the water. This is important for young children and weak swimmers. So once again, even though the parent may be providing the personal flotation device, if you notice that it's not a type 1 life jacket, I would encourage you to have that conversation with the parent and recommend that they bring in the type 1. Now the type 2 and type 3 is still going to be acceptable, but the type 1 is the primary type that you want to be looking for. Check the manufacturer's label to make sure that the life jacket is a proper fit for the child's size and weight. All right? Sometimes parents will want to send in an older sibling's life jacket or a life jacket that has been used for other family members. We want to make sure that this life jacket fits properly for that individual child. Life jackets designed for adults should never be worn by children. We actually see this happen quite often right here. Okay? If a life jacket is provided by a child's parent or guardian, the child care operation is still responsible for making sure that the life jacket is a U.S. Coast Guard approved and the correct size. Once again, here are some tips to ensure a proper fit, and this is from the American Red Cross. Make sure that the life jacket is properly fastened. Once again, if you notice that the fasteners are damaged or they're not in good repair, it is your responsibility to report that to the parent and not allow the child to participate in the water activity until you have an appropriate personal flotation device. The life jacket should be nice and snug around the torso. When lifting on the shoulder strap, they should not come past the bottom of the child's ears. A life jacket is designed not to ride up on the body when in the water. So you're going to need to kind of get the life jacket and pull up on it like this, all right? And if you notice that it's going past the child's ear, that's not a proper fit. It should be nice and snug. For a best fit, try the life jacket in shallow water under safe and supervised condition. Always make sure you're trying on the life jacket, making sure that it's a proper fit before the child enters the water. Remember, once the life jacket or personal flotation device gets wet, okay, it's going to fit the child a little bit different, and when the child is wet, right? So you want to make sure that it's nice and snug both when they're dry and then once they get into some water. So that's why the recommendation is there to try it in shallow water before you put them in deeper water. Let's now talk about some water safety tips. And I did include on the screen right here the website for the American Red Cross. There is some really good information from the American Red Cross that will help you keep your children safe and to protect your program and home, because all of the information that we're going over today can definitely be taken home with you as well. Something that I've always done in my past, whether you're taking children to the swimming pool located at your facility or you're taking children to a water park, is we always assign at least one adult to be the water watcher. And this is an individual that basically is out of the water, that basically circles the perimeter of the pool and does nothing but watch the swimmers. They have no other distractions. They don't engage in conversations or activities. Their whole responsibility is to basically walk around that swimming pool and focus on the swimmers. Okay? You may have other caregivers that are participating in the water activities that are playing games with the children and they're engaging in conversation and they're laughing and they're having fun. All right, and that's all very, very much encouraged. But the water watcher is the one individual that their only responsibility is to focus on the children and make sure that everyone is safe. The way I've done it in my past is I have not counted the water watcher in child staff ratio. That's how important this is right here. That they are a person that is completely out of ratio, that their entire expectation is to keep their eyes on the children in the pool at all times. No distractions. All right? So that's a good recommendation for you right there. Never allow anyone to swim alone. Now, obviously in our licensed programs, they must be supervised at all times, but this is mainly for, whenever you're at home. Never leave young children unattended near water, and do not trust a child's life to another child. Okay, even if you've got older children that are 12 or 13 years old that can swim competently, they should never be given the responsibility of someone else's life, all right? You must always have that adult present right there. Teach the children to always ask permission to go near water. Okay, plant that seed at the very beginning, all right? Like I said, have that one adult designated as the water watcher. I think that is such an incredibly important position right there. And another thing that I have always stressed whenever I have groups that are going out to water activities is the adults always need to be within an arm's reach of any weak or inexperienced swimmer who is in the water. All right? So it's almost like assigning primary care groups, just like we do in the classroom. But even when you're in the swimming pool, you kind of have primary care groups for your inexperienced swimmers versus your experienced swimmers. But I always want an adult within arm's reach of those inexperienced swimmers. Like we mentioned earlier, do not rely on the use of water wings, swim rings, inflatable toys, and other items designed for water recreation to replace adult supervision. Okay. Last thing we want to talk about right here is just some drowning prevention and facts. Drowning prevention and facts, and once again, this is coming straight from the American Red Cross. You can see their website right there on the screen, www.redcross.org. Okay? And I really want y'all to focus on this information because this is important. And when you understand these statistics, all right, when you understand these demographics, it's going to change the way you look at supervision. Okay, it's going to change the way, we talked about those primary care groups and the inexperienced swimmers, all right? We want you to really focus on safety. It's all about safety right here. Now, look at this. Drowning is responsible for more deaths among children ages 1 to 4 than any other cause except birth defects, all right? That's big right there. This is another thing that is a big eye-opener for a lot of folks. Drowning is the leading cause of death in autistic children and adults. Children with autism spectrum disorder are 160 times more likely to experience non-fatal and fatal drownings than their typical developing peers. So if you know that you have a child in your group that has either been diagnosed with autism or has signs and indicators of autism, you want to pay really close attention to their ability to swim competently and making sure that they have the adequate personal flotation devices needed. So when we go back to the beginning of the conversation, when we talked about children who may have a medical condition or a special care need that places them at a higher risk for injury or death, this is one of the indicators that you want to pay attention to right here. The other thing that we see with these statistics that have been published by the American Red Cross is when parents have no or low swimming skills or competence in that area or their ability, their children are also unlikely to have proficient swimming skills. So, it might be part of your conversation that you have with families if you are taking children on swimming or water activity excursions. Hey, mom and dad, or hey, guardian, tell me about your swimming abilities. Does the adult that's responsible for this child, are they able to swim competently? And if the adult says, no, I can't swim, but my child can, all right, I would still pay closer attention to that child and their ability to swim competently. All right, so there's some data for you right there. Just a couple of other pieces of information that I wanted to share with you. And again, this comes straight from the American Red Cross, but I think it's important for you to know when choosing how closely you're going to supervise the children in your care. It does say children younger than 1 year of age is more likely to drown at home. Most of us are not allowing children, under the age of 2 to go swimming at the licensed childcare facility. That's not something that's normal. Doesn't mean it can't happen, but that's why it's more likely to happen at home rather than at your facility or someplace else. All right. For children younger than 5, 87% of drowning fatalities happen in home pools or hot tubs. Okay. Most take place in pools owned by family, friends, and relatives. After pools, Bathtubs are the second leading location where young children drown. However, buckets, bath seats, wells, septic tanks, ponds, and toilets, all right, are also potential drowning sources for infants and toddlers. I highlighted this one because we talked earlier in the training about wading pools, all right? I would kind of add wading pools to this list right here. A body of water less than 18 inches, you always want to be concerned right there. Okay? Those children that are 5 to 17 years of age are more likely to drown in natural water, such as ponds or lakes. All right? So, I wanted to go ahead and mention this. Even though you may not have a pond or lake at your licensed child care facility, you may be taking children on a field trip that does have a pond or lake, all right? So even though there are no intentions on getting into that body of water, we have seen it still happen, where children are curious, they get near the body of water, they fall in, okay? They're not being properly supervised. You could have an issue right here. I also wanted to go over this. Drowning risks vary by race and household income. And once again, this is coming from the American Red Cross, but I think it's important to share as well. 64% of African American children, 45% of Hispanic and Latino children, and 40% of Caucasian children have few to no swimming skills. When a parent has no or low swimming skills or competence in their ability, their children are likely not to have that proficient skill as well. Okay, we mentioned that earlier. This impacts 78% of African American children, 62% of Hispanic and Latino children, and 67% of Caucasian children. All right, so once again, I think that these statistics are important to be aware of when you're deciding how closely you're going to supervise your children to keep them safe. All right, so that is our training on water safety. Again, this is a required training from child care regulations. You do have to have this training every year. There is going to be an assessment that you're going to take as soon as you finish watching this video that has right or wrong answers, and you're going to be able to find that assessment right here on timthetrainer.com. As always, if you have any questions about the material that we covered today, if you have additional questions or you need more information related to this material, you can always give me a call on our training hotline, 972-200-0504. You can email me, or if you go to our website, up in the top right-hand corner, there is a section for questions that you can send to us, and we can answer those questions in a timely manner. So this gives you the opportunity to interact with the instructor. Please make sure you ask questions about anything that you're curious about, especially when this topic, water safety, or any topic that is related to safety and supervision and health. We're always here for you. All right. Thanks a lot, everyone. Hope you enjoyed the training.